Joints. What if I pick this for the practical? Can you label this joint? This is the knee, right or left knee? Left. The tibia is anteromedial and the fibula is always posterolateral. This is the
right.
It is the right. I made you doubt yourself. Okay. This is the right knee. Okay, let's start with this. This would be the patellar tendon. Okay. This is the patellar tendon of your quads. This is going to be your quadriceps. We have another model right there. Do you mind reaching at the back? Yeah. See? Yes. It's a common tendon of the quads. Okay. So it's not just a tendon that attaches the quads to the bone. Remember that tendons also reinforce joints. Okay, they stabilize joints. The stronger your muscle, the stronger your tendons, the stronger your joints. Okay? So let's label, let's move this a little bit. Oh, there's a bone right there. You know what that is. We'll see more ligaments inside, but what is this ligament? I have one on each side. They are collateral ligaments, right? Collateral means both sides, okay? But this is on the fibular side. So we call it fibular collateral or lateral collateral. Okay? LCL ligament. Okay? This one is on the tibial side, so we call it tibial collateral or medial collateral. Like Tom Brady tore his MCL. You know? MCL is, but I don't know if that's what he tore. Huh? MCL, medial collateral. Okay. Next, if you go inside, there are two ligaments inside that cross each other. That's why they're called cruciate ligaments. Because cruciate, cross, they cross each other. So this is the, are you zooming in? Are you able to zoom in? Yeah. This is your anterior cruciate ligament. Okay. And of course, behind it is your posterior cruciate ligament, and they cross this way. Okay. And what about this?
Meniscus.
Meniscus on the medial side, medial meniscus. On the lateral side, lateral meniscus. Very complicated joint in the body. Okay. Any other joint? What about this? Okay. What do you call this joint? TMJ, very good. TMJ stands for temporal mandibular joint. What type of joint is that? Synovial, right. But what type based on movement?
Elevation, depression.
Hinge, yeah. Elevation, depression, hinge, right? What else? What muscle attaches here? Yes. So it looks like it's my favorite muscle, isn't it? I always mention SCM. Yeah. What joint is this?
Coronal suture.
That's the coronal suture, that's right. But what type of joint? Fibrous. No? Fibrous suture. Is it movable, immovable? Immovable. What's the term for immovable? Stenoarthrosis. Very good. Yeah. Very impressed. Anything else? Do we have a skeleton somewhere there? Somewhere here? Okay. How about this? What type of joint is this? Fibrous. Fibro, you're right, but not fibrous. Fibrocartilage. It's fibrocartilage, so it's your cartilaginous joint, but specific name, specifically symphysis. Where's another symphysis joint?
The pubic symphysis.
That's right, pubic symphysis. Okay. Name this joint. Well, it's a multiple choice, so you should be able to spell. Yes, sacroiliac joint. Very good. Sacroiliac. Name this joint. Not the type of joint, but the name.
Intervertebral.
Yes, intervertebral, in between the two vertebrae. Name this joint. You can't spell it yet, but it's multiple choice. So sacrum and vertebra. So yeah, vertebrosacral. Sacrovertebral, vertebrosacral. Okay. Sacrococcygeal. We're just practicing the names of the joints. If you remember, we say, if you know the names of the bones, you put them together and you have the name of the joint. Right? Like, what's the name of this joint? Yeah, sternoclavicular. Sternoclavicular. Do we have a shoulder joint somewhere here? I thought I picked it. That's the last one. Let's do the last one. Shoulder joint somewhere? No? I will leave that to you guys. No.
It's right at
Oh, thank you. You have a lifesaver. Okay. So let's, so this is obviously the glenohumeral joint. Does it make sense why it's glenohumeral? The glenoid of the scapula and the humerus, right? And obviously we have these duct tapes. I keep calling them duct tapes or ligaments connecting bone to another bone. This is the what? I know it's multiple choice, but what would you be looking for in your medical term? That's right. That's a coracoid process, and this is the coracoclavicular. No, number one. You're gonna look for coraco and the clavicular. What about this ligament? Acromial, coracoid. So coracoacromial, right? There's a coracoid there connecting to the acromial. Okay. Anything else? How about I think that's it for this. Okay. Again, just put the terms together and add the word joint or ligament. Okay. Anything else you want to label for the muscles? Did we miss anything? Serratus anterior, this one, like a serrated edge of a knife, serratus. I'm just looking for the femur, ball and socket joint, right? Synovial. Any questions? Good? Okay. Thank you.